tarsal collision. Tarsal collision is where two or more of your bones don't separate at birth, which causes severe arthritis pain once you get to a certain age, I should say. This foot is flat. This foot is flat. This foot has an arch. I don't know if you can tell the difference. Arch, flat. So, I'm gonna show y'all. So, it's a huge difference. I'm not walking, on my side. As you can see, I still have my corn on this side of my foot. But yes, so I'm not on this side of my foot anymore. I'm in the middle. This was me before. As you can see, I have like this corn here too because my foot grabs because you're not really balanced. All our feet, we walk like this. And now this foot is more straight. And I'm gonna show you the back where they go ahead and give you your sutures in the back of your foot. This is the back view. This is the back view of my foot. This is the surgical foot where I had surgery. I don't know if you can see my sutures. I have 3 sutures going back here, but now the foot is straight. Coming from the back. And as you can see, this foot that's not done, it's leaning towards the left side. I can do this now, but there's a difference. So this is what your foot will look like after you have surgery with tarsal collision. Tarsal collision, this surgery is not fun, but it will help you in the long run. As you can see, this foot is over and off to the side. You see that? And then I got this one done. So it's completely in the middle, complete foot. And I really like this angle. As you can see, one side is more red than the other side. I still have more healing to do. Your doctor will definitely tell you that. If your foot is more red, yeah, you still have a little more healing to do. My nerves on my foot still kind of ache a little bit, but they're not that bad. The pain is not that bad. All you have to do is just make sure that you massage your foot very, very well. If you do not massage your foot, you will feel that nerve pain. But this foot is the before and this is the after. I'm having tarsal collision surgery and I feel more sturdy when I'm on it. Of course, therapy is something that you will have to go through, definitely. But you can see, as you can see, I'm standing straight on this foot, and this foot is more off to the side. And this is where I will have surgery. I'm gonna show you what it's like walking with one foot with an arch and one foot like without an arch. I went through obviously a lot of therapy to be able to walk properly. Yeah, if you are looking to get this surgery, go ahead and get it. It is painful, and you're gonna have to sit your butt down and keep your feet up, because once you have that surgery, it'll be worth it. Okay, so if you're born with tarsal collision, most likely you won't know that you're born with it until you go through the pain and you go to see a doctor and you get x-rays. Tarsal collision is a condition where 2 or more bones in the back of your foot are abnormal, connected, or fused together. So that's bone, cartilage, and fused tissue. But usually it's the flat feet, foot pain. The pain gets worse with activity or sports, and trouble walking on like flat surfaces, not flat surfaces, but like uneven ground. Best thing for you is to wear orthotics. Go on and put that arch support on, because you already in foot pain. I mean, I remember when growing up having foot pain, I didn't know what it was. I really did not know what the pain was. I used to actually walk and put holes in my shoes because of the way I walked. So definitely I would get that looked at, because your doctor might tell you got tarsal collision, and you be like, what the heck is that? And you be sitting here like me, telling folks what it's about. July 30th will be a year for me after having surgery. It's been a little shaky. I had an infection. I did have an infection. I did get an infection, which was crazy, but long story. Best thing you would do is to keep yourself elevated after surgery. Keep yourself elevated. If you think you're gonna walk somewhere, only place you should be walking definitely is only to your doctor's appointments, and you have to invest in a knee scooter because you'll get around faster. Because you definitely cannot get around the way you think you're gonna get around on crutches. Me personally, I'm carrying around weight, so you know you be tired. So make sure you have all your stuff that you need. I had stitches and sutures, and staples. They say the staples don't hurt when you get them taken out. I ain't even gonna hold you. That it hurt. I mean, they'll give you some pain medicine. Make sure you get your right pain medicine. Make sure you take your pain medicine before you go to your doctor's appointments, because it hurts. The nerve pain is pain. So definitely make sure you take your nerve medicine. Gabapentin is one thing I used. Helped a lot. After surgery, make sure you massage your foot very well. Do not be afraid to massage your foot, because that is the main thing for you. If you ever think you're gonna get a pedicure again, massage your foot. The pain eventually goes away. Scarring is not too bad. Scarring is not bad. It's not that bad for me personally. Just make sure you massage, because if you do not massage, your foot will definitely stiffen up on you, and you do not want no stiff areas on the top of your foot. Soreness, it's not too sore, but it does have a little bit of an ache to it. On where I had my foot done, nerve pain is 10 if you don't take care of your foot. Keep you some good moisturizer. Keep you some good moisturizer on you. And another thing that I used was corn husks on my foot, which helped a lot. Another thing that you can invest in is these bands. These bands where you are going to use for like good stretching and stuff, but I also use these to stretch my foot. I just place on the back of my foot, and I use it to, push on my foot for great strength. So this is great. These came in handy, because I'm like, I'm supposed to use this in my thigh. These are pretty sturdy. I don't know, I'm not strong enough for that, but yes, these came in handy for stretching your foot, when you're sitting and pulling in your foot. These came in handy, or you can just use a towel. Of course, you're gonna get gauze and stuff. You're gonna get these once you're done. I recommend keeping these, because your healing process is definitely gonna need these, because sometimes certain things is not comfortable or it's not tight enough for you. You can definitely adjust, your compression with that. And also I did buy these were like $30 from my doctor's office where I got my surgery. Compression socks. These go all the way up to my knee, and I still use these because it helps with inflammation. Their swelling, keeps the swelling down. Make sure you keep these on you. Keep you some compression socks. All right, these come in handy. I tried BioFreeze. That's all right. It's all right. I can't get hit with it though. Ibuprofen, keep your inflammation down. Definitely, once you have the surgery, keep your foot up. You do not want swelling because that layer of skin on your foot is thin, you know. And when I had the surgery, I'm like, hold up, my foot, my skin is, my stitches started dehiscing. So, from swelling and stuff, and I had a wound vac as well. But make sure you keep your foot elevated because you do not want swelling. I also had a machine that hooked on my leg and it pumped up every few seconds cool air to keep my leg nice and cool. Ice pack, ice your leg. Best place to ice is the back of your leg right here. That's the best place to ice your leg. These are my scars right here. These are actually very soft. As you can see, my skin is moving. At first it didn't move, but you need to make sure you always massage your foot, always. But other than that, yes, these are my scars and I appreciate them. They're not that bad. I actually love how my foot turned out, but yes, make sure you ice under your leg. Your whole leg is going to be small. I actually didn't have a cast, so that was cool. My foot just constantly kept getting unwrapped for gauze to be changed. I also did have a little collagen, but that was through the wound vac process and healing from infection. But other than that, yes, you do not want to be up walking on your foot. Do not be up walking on your foot. What you up walking on your foot for? Not even trying, like, I'm just saying, like, that blood flowing down towards your foot, even if you're on a crutch and you got your foot up, like up, that blood is still flowing. It's still, heart's still pumping, that blood is still flowing. So you need to be sitting down because swelling is no joke. All right. I am going to be getting my other foot done. I will be showing the process of that once the time comes. But other than that, I do appreciate the surgery that I had. Tarsal collision is no joke. It is very painful once you really feel like, you feel it. It is painful. It feels like I'm walking on a plank, like, plank. And it's not a good feeling on the right side. So I can't wait to get this surgery done. Yes, so, I walk pretty normal. I'm happy about it. And yes, I'm going to be able to be on my feet more to where I can, work out as long as I want to without being in pain, So, yeah, stay tuned. Like, comment, and subscribe. I appreciate you guys for watching, and stay tuned for the journey.